Hello, welcome to my channel. I'm Dr. Drabian, radiologist. This is a sonography-radiology training channel. I will present different videos could be benefit for physicians and general population. In this video series, I will talk about vegetable and plant inspired signs in radiologic imaging. This is the third video in this video series about coffee bean sign. What is the definition of coffee bean sign? Coffee bean sign, also known as kidney bean sign or bent inner tube sign, is a sign on an abdominal radiograph of sigmoid volvulus. Sigmoid volvulus is a cause of large bowel obstruction and occurs when the sigmoid clone twists on its mesentery, named the sigmoid mesoclone. What is the epidemiology? Large bowel volvulus accounts for about 5% of all large bowel obstruction, with about 60% of intestinal volvulus involving the sigmoid clone. It's more common in elderly. What is the clinical presentation? Symptoms are that of large bowel obstruction, including constipation, abdominal bloating, and nausea and or vomiting, which onset may be acute or chronic. What is the etiology? There is a wide range of causes, which some of them are geographically specific. The first one is chronic constipation and or laxative abuse, fiber-rich diet, especially in Africa, and Chagas disease, especially in South America. What is association? Chronic neurological condition, for example, Parkinson's disease, multiple sclerosis, and pseudobulbar palsy. And the second, medication from chronic psychiatric condition, for example, chronic schizophrenia. There are two series of imaging findings, the first one in plain radiograph and second in CT scan. Abdominal radiographs will show a large dilated loop of the colon, often with a few gas fluid levels. But specific signs include coffee bean sign. The second, Freeman ball sign, means three dense lines converge toward the site of the obstruction, and absent rectal gas. Another specific sign is liver overlap sign, means the sigmoid loop ascending to the right upper quadrant and projecting over the liver shadow. And in this lateral radiograph, we can see obviously liver overlap sign. Another specific sign is northern exposure sign, means erect radiograph shows the displacement of the sigmoid clone above the transverse clone. What is the imaging findings in CT scan? Usually, we can see a large gas-filled loop lacking hostro, forming a closed loop obstruction. One of the specific signs is whirl sign, which creates by twisting the mesentery and mesenteric vessels, which looks like as a whirlpool sign. Another sign is bird beak sign. In this image, this is a soft tissue window and this is long window. In soft tissue window, another one, we can see wall line, and in long window we can see bird beak sign at the site of the obstruction. X mark the spot sign, which creates by crossing loops of bowel at the site of the transition. As we can see in this Sinaloop CT scan, at the site of the transition of the bowel loops, here we can see the similarity between this crossing over site and X letter, which named X marks the spot sign. Another CT finding is split wall sign, means mesenteric fat seen indenting or invaginating the wall of the bowel. As we can see here, mesenteric fat separating the two walls of sigmoid clone. Another CT finding is steel pan sign. The steel pan, also known as steel drum or pan, is a Caribbean musical instrument invented in Trinidad and Tobago, which became very popular in Trinidadian carnival festivities. There is a close resemblance of dilated bowel loops in axial CT image and the steel pan instrument. What is the differential diagnosis of sigmoid volvulus, large bowel obstruction from other causes? The second, cecal volvulus and clonic pseudo-obstruction, which the most important differential diagnosis is cecal volvulus. The following points may be helpful to distinguish between sigmoid volvulus and cecal volvulus on plain film. Sigmoid volvulus arises in the pelvis at left lower quadrant and extends toward the right upper quadrant, but in contrast, cecal volvulus rises in right lower quadrant and extends towards the epigastrium or left upper quadrant. Sigmoid volvulus has ahistral in appearance. As we can see in this image, there is no any haustral pattern, but in cecal volvulus, clonic haustral pattern is maintained. As we can see in this image, there is haustral pattern of large bowel. Sigmoid volvulus causes obstruction of the distal large bowel, therefore the ascending, transverse, and descending colon may be dilated, but cecal volvulus distal colon is usually collapsed, and we can see the ascending, transverse, and descending colon, but the small bowel loop dilatation is seen. In sigmoid volvulus, a few air fluid levels may be seen. As we can see in this erect position abdominal radiograph, a shadow of coffee bean sign, and also a few air fluid levels. But in cecal volvulus, usually there is no any air fluid levels, but one air fluid levels may be seen sometimes. If you like this video, please subscribe this channel. If you would like to get notification for the next videos, please press the small bell. If you have any question or video suggestion, please write in the comments. Thank you for your attention.